Hello. So here I'll be discussing a case of a CT of hip where of a patient who had come around 4 months following a road traffic accident. While he was injured, he had underwent an X-ray scan which showed a subcapital fracture. So now after 4 months, the patient has come and we have got a CT scan of this patient. On the right side, we are seeing that the femoral head, there is no femoral head actually, and there is no resemblance of it. Only osseous debris are noted within, and a part of the femoral neck, the superficial or the superior part, it appears to have been eroded a bit. It looks like a licked candy type of appearance. So this is the appearance of the femoral neck. And now on the axial scans, this is the part where we call it as the anterior wall of the acetabulum. This would be the anterior column. On the posterior aspect, we are not seeing the posterior wall, neither are we seeing the posterior column. So this is a fracture of the posterior column as well as the wall. And if we go superior to this, we'll be also seeing a bony fragment which has been come out from the supraacetabular region of the right iliac blade. So these are the fractures which might have occurred earlier, but now we are seeing a gross effusion. So there is a gross right-sided hip joint effusion, and we see that the femoral head is not seen anywhere. And also there are erosions and there is dissolution of the prior bone. So there is also one more thing that we see is the capacious right-sided acetabulum. So this all appearance is not anything related to a septic etiology or anything, but this is just a sequelae of the untreated fracture. So this is how an untreated fracture would go through its course, and will be able to see the dissolution, osteolysis, and this large collection is nothing but a liquefied hematoma which might have occurred then, and we would have now gotten the osseous debris within. So this is how the post-traumatic osteolysis looks like. So this should not be wrongly reported as a type of septic arthritis. This is just how a ignored traumatic injury in the subcapital region usually appears like after some period of time. So the femoral head should be vascular had it been only in the region of the intertrochanteric aspect or in the neck region. But we see that the subcapital aspect here, it is susceptible to get and avascular necrosis, and that's why it has become dissolved. So one more thing that the clinicians, that the orthopedicians need, is the limb length discrepancy. So we should also give in our report the size or the shortening of the limb on the one side compared to the contralateral aspect. This is given in respect to some solid base. In this aspect, we are doing the length, we are putting an horizontal line through the lesser trochanter on the left side, and we'll see how superiorly migrated the right-sided lesser trochanter is. So this is about some 2.2 centimeter. So this is how shortened the right limb is. So when they go in and operate and do a total hip replacement, they also need to see how long the stem should be. And so that when they do the operation, there should not be a scenario that post-operatively there is a limb length discrepancy. That's why they get the CT scan of the entire pelvis so that we can compare with the normal contralateral side as well. So this should be borne in mind while reporting such cases. Okay, thank you.